This paper looks at xylitol in a nasal spray and its effect on COVID patients. As demonstrated in the previous paper that covered iota-carrageenan and xylitol, xylitol concentrations at 50 milligrams per milliliter of solution found that it had some virucidal capacity against COVID. So here they're doing a randomized controlled double-blind trial to test xylitol nasal spray against a saline nasal spray. In this study, they looked at COVID-positive patients that tested PCR positive within the last 3 days. And at the outset, both groups were not statistically different from one another. This included things like demographic characteristics and vaccination status, and then none of the patients were hospitalized, where the authors conclude that both xylitol and saline were equally effective in decreasing the time of symptom resolution, with the only major difference between xylitol and saline nasal washing being that in the xylitol group there was not persistent anosmia, which is that persistent loss of smell. And as we've already covered before, saline doesn't really do anything against COVID. The one caveat being that if it's an isotonic seawater nasal rinse or nasal spray, that will flush out the COVID and reduce the number of symptoms and the duration of infection by a couple days. However, saline alone does not have that property. So unfortunately, it looks like, at least in this study, that xylitol did not have an effect on COVID for an active COVID infection. So diving deeper in, patients in this randomized controlled trial were either treated with intranasal saline at a 0.9% concentration, that was the control group, where alternatively they were tested with a xylitol spray that consisted of purified water, 11% pure xylitol, a 0.85% saline concentration, and 0.2% grapefruit seed extract. So we're going to make a little bit of an assumption here. So we know that for saline, they're reporting it at the 0.9% weight by volume concentration. What this means is that there's 0.9 grams of sodium chloride within 100 milliliters of solution. So when they're reporting 11% pure xylitol, we will also make the assumption that this is a weight per volume designation, which means it would be 11 grams in 100 milliliters of solution, which would put this at 110 milligrams per milliliter, which means that this concentration would exceed our 50 milligrams per milliliter cutoff for virucidal activity of COVID, based upon that previous in vitro study. And for the procedure, they did 2 sprays per nostril every 3 hours while awake. And this was for the first 72 hours, and then after that period, it was 2 sprays per nostril every 6 hours for up to 4 times per day. And then this is the plot of that data between the saline and the xylitol groups. As you can see, they were not statistically significantly different over the course of the 30-day study. So there was no difference in self-reported symptoms. Very early on, by day 3 after xylitol treatment, there might have been a small effect, but that completely went away after day 3. And this is in response to daily symptom scores. And the one thing the xylitol might help with is anosmia, that lack of smell. There seemed to be a better signal there within the first 7 days, but again, that dissipated after the first 7 days. So for the mechanism of action of xylitol, the spray can induce reflex nasal secretion secondary to hyperactivity of submucosal glands and histamine release. Essentially, when you use a xylitol nasal spray, it's helping to flush the nose, similar to how saline will also flush the nose. Meaning that, similarly to saline, xylitol probably isn't going to do much for a COVID infection. It may work okay for early exposure to flush things out to try and prevent that infection itself. So it might be good as an after-exposure preventative, but if you have an active COVID infection, this is not what you're going to want to use. What you're going to want to lean into is either the nitric oxide nasal sprays or the iota-carrageenan nasal sprays.